What does actor Patrick Swayze, Professor Randy Pausch, Apple icon Steve Jobs, and my grandfather have in common? They were all diagnosed with pancreatic cancer, and unfortunately, they all passed away from pancreatic cancer. My name is Candace Sherwood, and I'm here to give you a brief background on what pancreatic cancer is. I'm going to start off by giving some brief definitions as to what is cancer, what's the pancreas do, where is it located, and then move on to symptoms, staging, diagnosis, prognosis, and treatment, and things like that. So, as a natural occurrence, cells in the body must grow, divide, and die. Sometimes, if there has been DNA damage and things like that, these cells might start growing out of control. And that's essentially what cancer is. Cancer is uncontrolled cell growth. The pancreas is an organ that aids in digestion by releasing digestive enzymes. And it's located by the liver and the stomach in the upper left portion of the body cavity. And it lies beneath these organs, so it's not easily accessible. So putting it all together, pancreatic cancer is uncontrolled cell growth of the pancreatic cells. It tends to target certain populations, like the older population. It tends to affect more men than women. It seems to be tied to cigarette smoking, but there's also a genetic component associated with it. So if maybe your father or your grandfather had pancreatic cancer, your risk might be higher than somebody who doesn't. And pancreatic cancer is known as the silent disease because there's generally no symptoms until this cancer has progressed to the later stages. And usually during the later stages, it has metastasized to other parts of the body. And metastasis is basically just, it has spread from the original organ to another, like, close organ, for example, from spreading from the pancreas to the stomach or the pancreas to the liver. So there are 5 stages associated with pancreatic cancer, stages 0 through 4. And stage 0 is basically when there are abnormal cells on the pancreas lining. By stage 1, you have a tumor that's less than 2 centimeters in diameter. By stage 2, the tumor is greater than 2 centimeters in diameter. And it's during stages 3 and 4 where you see the metastasis of the cancer to other organs that are surrounding that area, and when symptoms start to arise. And some of the symptoms that usually begin to show up at first are back pain, nausea, abdominal pain, or yellowing of the skin and eyes, which is known as jaundice, which can be somewhat ignored at the beginning but as the cancer progresses to the further stages and it gets more serious, you'll see that you have fatigue, weakness, and you ultimately reach the point where you have a loss of appetite. And this is when people usually go seek medical attention. How do doctors diagnose pancreatic cancer? Usually it starts off with a non-invasive procedure, which is usually a CT scan, a PET scan, an MRI, or maybe even ultrasound. And if there's something abnormal in those results, they'll go into a more invasive procedure, which is usually a biopsy. And a biopsy is basically removal of living tissue from the organ of interest to see if what they suspect is actually true and present. And once a patient is diagnosed with pancreatic cancer, there's a couple options. If the pancreatic cancer has not metastasized to another organ, they can try the Whipple procedure. And the Whipple procedure is basically removal of the portion of the affected pancreas, in addition to removal of the beginning upper portion of the small intestine and the lower portion of the stomach, just to make sure that they cover all bases and that it won't return. And not many people who are diagnosed with pancreatic cancer have this option. For the most part, you're either going to have to go through chemotherapy, radiation, a combination of the two, and under some circumstances, if it's bad enough, patients will just choose not to take any treatment at all. There's new methods being developed in research right now, but nothing that has shown up, in hospitals as yet. But the prognosis for pancreatic cancer, whether you get Whipple procedure, choose to do chemo, radiation, or choose to do nothing, overall is poor. Because those who are candidates for the Whipple procedure, 5 years after receiving the treatment, only 25% of patients will still be alive. If you choose the chemo, radiation, or no treatment route, your 5-year survival rate is even shorter and is at about 5%. And the National Cancer Institute says that in 2012, of the 44,000 patients that they believe to be diagnosed with pancreatic cancer this year, 37,000 of them will die. So, in conclusion, pancreatic cancer is not a cancer that's generally spoken of, but it's very lethal and it has a high, death rate. Not many people survive this cancer, and more research and a better understanding of this pancreatic cancer will hopefully provide greater opportunities for early detection and better treatment of this cancer. Thank you for your attention.